If you're a high-achieving woman who's exhausted by stress, stuck in constant conflict, and tired of being overlooked in the exact rooms where you know you were born to lead, then this podcast is for you. So here's your host, Pallavi Jain.
Welcome to Her Boss Brain, Stress to Success, the podcast where we explore how high-achieving women and leaders can move from stress to sustainable success by tapping into the most sophisticated machine will ever operate, the human mind. I'm Pallavi, and here we talk science, strategy, and actionable tools to help you lead from within, take conscious control of your energy, and activate your boss brain, your ability to be on self-start and make intentional choices under pressure. Today's episode is about something we all know but rarely confront. Leaders and caregivers often lose access to their own humanity while trying to support everyone else. They push through exhaustion, stress, internal conflict, believing that giving everything to others is the only way to lead effectively. But the truth is, we cannot pour from an empty cup. Think about it, right? We can master every piece of external technology in the world, yet the most sophisticated system, our own human technology, remains largely uncharted. How can we lead others effectively if we don't understand and care for the machine running our decisions, reactions, and empathy? Joining us today is Dr. Jessi Gold, MD, MS, the inaugural Chief Wellness Officer for the University of Tennessee System, a role actually overseeing all 5 campuses, supporting over 64,000 students and 15,000 faculty and staff. She's also an associate professor of psychiatry at UT Health Science Center and a nationally recognized mental health advocate. She is widely cited in the New York Times, The Atlantic, Self, InStyle, and more. And Dr. Gold is the author of the national bestseller, How Do You Feel? One Doctor's Search for Humanity in Medicine. And she brings a rare combination of this clinical expertise, system level insight, and real world empathy to her work, helping high performing professionals manage stress, burnout, and the emotional toll of caregiving. Jessi, we are so excited to have you. Welcome to Her Boss Brain.
Thank you so much for having me.
Of course. And, we try to set like intentionality is such a big piece of leading from within. So, if I may, would you like to take a moment and give me one word that describes how you're entering this conversation today, or one word that describes how you feel right now?
Excited? Does that work?
Absolutely. We're happy to hear that. And super. And if I have to describe one word for me, I think it would be, curious. And that's exactly how I want to dive into this conversation with you today. So, shall we get started?
Absolutely.
All right, then let's start with your book because it's so intriguing and so amazing. So, Jessi, your book opens with a moment where you confronted your own limits in practice. Basically, a moment that changed how you viewed caring for others. So, for our listeners who have not had a chance to check out your book yet, can you share that story and what that realization taught you about yourself and the way we approach literally leadership and caregiving?
Yeah, I think it's really interesting because when you see patients, you sometimes are like pretty set on how you're going through the motions. Like you're just like, I'm good at this. I know what to do. I show up, I do these things. And, I'm not hurting anyone. I'm listening. I'm there. I'm present. I'm doing all the things that I can do. When we think like that, sometimes things become a little bit like robotic, like we can go through the motions and maybe we're there, but we don't even realize we're not as there as we were before. And for me, like, I didn't know I was doing anything until honestly, my job is talking to patients and I see patients that are often healthcare workers, but students and faculty and staff too. And I was talking to a patient and I went through what I would consider sort of like my common motions, which is like, hi, I'm Jessi. Welcome to this visit. This is what a visit is, like confidentiality, etc. What brings you to see me today? Kind of just like, that's how I start visits. That's what I do on a new patient visit. And the patient said, oh, I mean, I've already met you, Dr. Gold. And I sort of had this moment where, like, I went from just like going through what I know I needed to do to being like, what? How did I do that? And, in psychiatry, that then requires repairing the relationship and sort of trying to find ways to express where the issues are and try to help them still trust you and all of that. And obviously, trust is so important in psychiatry, as is remembering a person's story and their and empathy, right? But when I have a patient who's scheduled for an hour, I assume that they're a new patient because my other ones are half hours. And usually when I'm on top of things, I will have gone into the chart, double checked my last note, looked at what was going on, and then I would be able to say, like, oh, like last time we talked about this. I was tired. I was burnt out. I was a psychiatrist seeing healthcare workers at the height of the pandemic. And I just didn't do that. Like, I wasn't on like pace. I just wasn't keeping up with my stuff enough to do the other things before they came. I was lucky I was on time for the visit. And
Yes.
so I just went 1 hour, new patient, start talking. And
Autopilot.
yeah, it was like on autopilot. And also, like, I think that, as many healthcare workers could tell you this too, but like, sometimes to protect yourself in work, you do depersonalize and sort of like remove yourself a little from the situation to not hear and feel and see all of the things that you
More
are hearing and
emotionally.
feeling and seeing.
Yeah.
And so sometimes when that happens, it's not as like, oh, that person was the person who told me that, because if I only met them once, like, I might not have that recognition because I
Yes.
protected myself or whatever. But in psychiatry, not remembering someone means that somebody told you something they've never told you or anyone else before. And now they feel like they are unheard or, like, invalidated in some way. And, for me as an empath, for me as a caregiver, for me as a person, is one of the worst things I could do. I think I've had healthcare workers read that and say, I forget people all the time. Like, that's not that big of a deal. We have big caseloads, but psychiatry is just really different. I don't have a
Yes.
huge caseload. I don't like the relationship is critical to success, the relationship and trust and all of that. And so it is one of the, in my opinion, worst things I could have done to hurt someone, who was coming and trusting me and caring about me. And so for me, it was like something's wrong with me, because I would never do that given a choice. Like, I would never do that at the height of my skill set. I would never do that at 50%. So I was like, something's off. Like, how
Yes.
could I have let whatever is going wrong with me impact patients at all? And so for me, it was like a giant, like, hey, what's up with you? Figure out what's wrong with you. Warning sign for me.
Yeah. And then what did you do with that?
Yeah, I mean, I've seen a therapist like regularly for, we're on 6 years, like weekly. This therapist, I've seen therapists before, but with this person. And so I already had like that part linked in to have the conversations to better understand what was going on. I had some awareness, which you'll hear in the book, which I can talk about too, but like,
Yes.
that I was really tired, that there were things that were off, that I was falling asleep every day after work on the couch and not being able to fight that with just like heavy fatigue, that I was
Yes.
just like not responding to messages as much as I like usually do, and was just like not like in my off work time feeling as good as I usually did, and had some like, thoughts about what that was. And it took me a really long time to be able to actually identify what that was as being burnout. But once I had that happen, I was like, oh, this isn't something I can just try to figure out like as I can in my free time on my own. This isn't something that is going away. This isn't something that is now just impacting me. And that's all that matters. I think
Right.
caregivers, in a lot of ways, all forms of caregivers, will often say things like, well, it doesn't matter what's
I'm
up in my
fine.
life. Like, I'm doing the thing as well as I can. And I can remember saying sometimes even to my therapist, like, even my 75% is better than some people's 100. So that's good. I'm still there. I have a lot of healthcare worker patients who, when by the time they come see me, they say something like, I haven't hurt anyone yet. It's like a badge of honor that they are
Yes.
coming before that, right? Like,
Right.
but we can have a lot go wrong in the rest of our life before
Yes.
we get to the part where we're like, forgetting a patient, hurting a patient in whatever way you want to call hurting a patient. And I think as a patient listening, you probably are like, oh gosh, what a terrible thing to say as a barrier. But I think as a caregiver listening, you can also understand that we show up, and we show up
Yeah.
because we're supposed to show up. And if we can't show up, we don't know we can't show up until we really can't show up. And so a lot of it gets pushed under the rug. A lot of it is just, I'm tired. Why am I tired? I don't know. I'm just in a bad mood. Like all of this stuff until you get to the point where you can't do that anymore.
No, that makes sense. And I just want to point several things that comes to mind, but we'll unfold that as the conversation goes. But two things I want to point out here, which I think you said, which is so important. One, like, when we see a healthcare professional, or we see a psychiatrist, or we see executive, running an organization, we think like they are like gods and they have it all figured out. I mean, they are humans too, right? They have the same human technology that we all do. So I think it gives that permission slip that at the end of the day, we are all human. That's number one. And number two, I think what is beautiful about your story is that even though you're in the medical profession, one, it took you a lot of time to really figure out what was happening. And second, at the end of the day, you owned your life and you own those decisions of actually going to someone and asking for help rather than taking it for granted or saying, oh, I'm fine, and just brush it off, because I think that is so important. And I can totally see, like, that moment clearly shaped your path, because my question now that comes naturally to my mind is, how did it influence then your decision to then move from, or did it, or and just happened, is how did you move from like clinical psychiatry into system level leadership, eventually becoming the chief wellness officer for the University of Tennessee system?
Yeah. So, psychiatry being the fourth child, one of the things that I will most say is I'm observant. I've always been observant, and
Yes.
I've always not wanted to take things as they are. Like I've always kind of said, why is it that way? Why didn't we do it? Like, your kids are always asking why. I never stopped doing that.
Right.
And I think that was a hard lens to go into healthcare training with, because I don't know how many of your listeners are healthcare workers, but there's just so much in healthcare that you just are
Yes.
like, like if your lens is that, it's almost like your eyes hurt. It's everywhere. And
Yes.
so much of it is systems that have been in place for a really long time that probably aren't changing anytime soon, but you just kind of go, what, why, what, all the time. So through healthcare training, I think I paid attention to that, but also tried to know that like there were only certain things I could do as a trainee, or there were only certain things I should be bothering with at my time, because I really needed to focus on training and clinical care and all that stuff.
Right.
And so where I could, I tried to do things or do research where it made sense, because I could do a research project on medical student mental health and access to care. Or I could do something in residency where we did support groups for med students as residents. I could do things like that, and it felt like I was helping, but it wasn't like this grand system, huge change. But I was chief resident, so that was kind of a start to thinking more like that. And then, when I took my job, I was really just like doing clinician stuff, like really working on the college campus as the psychiatrist, and had some time for writing because I was writing popular press pieces still at that time. And,
Okay.
what happened was there was this thing called the pandemic. And, I'm on the campus. I'm a person who has done research and advocacy around healthcare worker mental health and some writing. And so I have like this lens that's like, this is going to be a problem. Like,
Yep.
there's no way this isn't going to be a problem. And so, with that lens, I approached leadership and sort of was just like asked a question, which was like, what are we doing for the mental health of the folks who work here? And they were like, oh, what are we doing, basically? And so I got tasked with a couple other folks to like come up with a plan. And so for that,
Yeah.
that meant seeing what the coasts were doing, because I lived in the center. So it was going to take a little bit before the pandemic looked the same in Missouri as it was looking in New York or LA, but understanding from my peers there what they were seeing already in healthcare workers and what like could be beneficial, making that plan, really trying to figure out how to help, like bringing people together to have conversations. And so, I did that on a, we'll call it volunteer basis for about a year. And then, the pandemic didn't go away and I was still doing that. And I said, hey, like, I'm pretty sure this is a leadership role at this point. Like, I'm not sure, like it didn't exist. We've had a lot going on, but like most people in the hospital system, if you ask them like who's in charge about this, people would point to me and a couple other people who are doing resident focused stuff or med student focused stuff. And like, can we make it a leadership role? And the chair was open to that. And so I started a role just called Director of Wellness Engagement and Outreach in our department, but it was housed in psychiatry, but I was doing stuff for most faculty and staff. And at the same time, I had been furloughed from the undergrad because they didn't need all of us sitting there as providers, but I was full-time faculty, so you can't really furlough a full-time faculty member, which is like a complicated academic talk to say, if you're staff, they have to pay you. If you're faculty, they're already paying you, you're salaried. So then they say, what do you do with your time? And so in the context of that, where I was setting up all of this stuff, I also said, well, like, why don't I just open a clinic for faculty, staff, and their dependents? And so everything sort of like in the context of the pandemic happened quite quickly for me to like align, which had been a long-standing research passion, advocacy passion, life experience passion, to being like everything I'm doing is this. And so that was yeah, and it was like real fast. Honestly, I don't know if it would have happened without that. Like I could see very different paths for me, really like teaching and education, and I could see me having gone more towards like a program director, teaching kind of deanie route that way instead of like the wellness stuff. But I started doing it and, did it for a bit from WashU and then was ready to change environments and talk to a bunch of people. And this job where I am in Tennessee kind of was designed with me in mind in some capacity. What's really cool about it is it actually gets me back to the undergrad stuff too. So I said I was the psychiatrist on a campus like that. If you would have asked residency Jessi, like, what do you see yourself doing? Residency Jessi would have said, like, I want to be a psychiatrist on a college campus. I love college students. Cool. That's what I want to do. And the pandemic sort of pulled me back from that to do healthcare workers, though I would see dependents that were in college and home. So it's not like I stopped that completely. But this job is all of it because we have 5 campuses. One of the campuses is a healthcare, is healthcare students. It's a health science center. That's where I'm based. And then we have 4 campuses that are traditional graduate, undergraduate programs. And so it's like this cool combination of all of the things in a sort of weirdly magical way that if you would have, again, ever asked me, I don't think I could predict it, which is funny as you kind of think about your podcast and the folks listening, like people always are like, well, what do you see yourself in 5 years? Or and I'm like, I didn't seem like I couldn't have made this up. Like, I don't even know how I got here. Like, this job was sort of invented and didn't exist. And then, like, if you would have asked me again in residency, like, I don't know that you can't make up jobs that don't exist, but also like looking at the landscape of chief wellness officers, they're often hospital based. And this is a weird, different version based in higher ed. And so I don't think I could have predicted it. And so I think I would say to people listening, like, sometimes things happen that align with like your mission, vision, passion in an unexpected kind of like in this particular situation, kind of tragic way, but you feel like inspired to help and step up. And it just feels like the stars align in a lot of ways. And then if they keep aligning, like, don't look at a gift horse in the mouth or something like that, and just kind of go with it. Because I think, for me, it wouldn't work for everyone to do. Like, inventing roles is hard for people. Stepping up in a crisis or tragedy is hard for people. but I don't know. It's been good for me, I think.
That's really cool. And I have to say, I often tell my, my listeners here that I truly believe whatever happens, there is always a reason. And your story is kind of testament to that. Like, you could never have predicted where you would land. But as you were talking about, all these, it really took me back to my Harvard days when I was navigating the university and the various facets that come with the university culture as an HR leader. So now you are overseeing wellness across 5 campuses, right? With thousands of students, faculty, and staff. What are the biggest challenges you see, literally, for leaders in maintaining their own well being while also supporting others? Like, if you could give us one example, or are there
Sure.
early warning signs that are there that they don't see? Like, any insight you can share with us?
Yeah, I think it's a lot of, I mean, a couple of things I'll say, like when you like what you do, it can be confusing when you are like, when work ends and life begins. Or if you really care about the people you're helping, either
Yeah,
thing.
yeah,
So I think it can be really easy to go, well, I'm just doing this thing that I enjoy that helps people. Or like, for
yes,
me, sometimes like writing is not my day job, but it's still work. And so I'll be like, I'm just writing. It helps me process. And so I think it's pretty easy to like tell yourself a story that is like, but this is good for me because having meaning and purpose matters, and this gives me meaning and purpose, and I enjoy it and I feel good doing it. And that's all true, probably, but it also isn't actually taking care of yourself. It's still taking care of other people. And so it's important that like we're able to step back and still say, like, yes, and I need to do something for me. I think it's also really easy to just not identify yourself in the equation. So the reason the book's called How Do You Feel, but also like one of the biggest things I've learned about myself is like I'd never stop to ask myself that question. And I spend all day asking other people that. And it's almost silly how simple that is, right? To
yes,
kind of like check in, see what you're up to, notice some things about yourself. But if you don't do that, no one else is going to do that. And if you
yeah,
don't do that, you're not going to notice a subtle change, and you're only going to notice when you're falling asleep every day after work or you forget that you met a patient, right? And that's not
yeah,
what any of us want, because at that time, what you can do is so much more limited. And if I noticed earlier, I would have had a lot more options, just like any of us would. But it's also just like having some ownership of yourself in the equation. It stinks that that's true, that there's not a big system, team, etc., focused on helping you at all points in your life, but there is some amount of it that still has to be you, because you
that's
have
right.
to have some ownership of, well, no one else is going to do it, so
That's
I need
right.
to do it.
That's right. And you literally said that's exactly what happens when people are thinking, oh, I'm just following my passion, or this is something I love doing, or I'm helping. The other thing that I hear is I'm just working hard. So, like, what patterns do you see from a medical point of view, or even as your lived experience, or, sharing and mentoring so many people and undergrads in your kind of network? Is like, what patterns emerge that surprise people who think they're just working hard?
Yeah, I mean, I think that there are subtle things we don't realize we're doing. So sometimes that's what it's like for us in the off hours with our partners or friends, and we don't realize we're
Yes.
doing that. Sometimes I see people cutting out the things that bring them joy because they think they have no capacity for it, or like they'd be a bad mentor. Like, who wants to
Yes.
be mentored by me right now? That's silly, right? But when you meet with a student or help a student, it feels very different than 75 virtual meetings that maybe get nowhere, right? It's just a very different work, right? And I
Yes.
think
Yes.
a pattern I see in folks is like this: I'm just going to say no to everything.
Yeah.
And I think, and it's fair. I'm like, really, like, more power to you. Please say no, because we need to do it more. But like the idea of just kind of being like, oh no, like none of that. Like, we need to be careful that that's not like where we get meaning in a spirituality way, where we get
Yes.
meaning from like colleagues and friends socially, where we get like actual like intellectual like stimulation from like going to a library, going to a museum, like whatever it is about you, like that you like. I think
Yeah.
that gets neglected when we try to just kind of blatantly go, none of that. Like, I don't want any of it.
No, that makes sense. And I think there are two other patterns, and I would love to share it with you because I think you might resonate with that because I see this clearly when I'm doing my workshops as well at these corporate levels. I still remember there was this VP client, and I was talking to her, and she hadn't felt like herself in months. Okay. She was always pushing deadlines, managing teams under stress, and never pausing, literally. And so I saw that guilt and perfectionism were literally driving her overfunctioning. And her inner alignment was literally missing, which was causing decision fatigue, overwhelm, and constant conflicts in her team. So I feel like those two, I've seen a lot, especially in women, where these two patterns from guilt and perfectionism really shows up. But what really happened was when she applied the ATM framework and activated her boss brain, as I call it, she learned to arrive in the moment, take responsibility for her energy, and then make a conscious choice about where to focus. Kind of what you're saying, right? So the ATM really helped her do that and giving her a framework. And within a year, she became a completely different leader. She was much more calmer, intentional, and present. And she found that balance of either doing everything or not doing anything, right? And her team noticed that shift.
Yeah.
Conflicts decreased, and she rediscovered her purpose and alignment. And so I really feel this is a perfect example of how a structured approach to inner self leadership can literally restore humanity while sustaining performance, right?
Yeah.
So, and this is where I see the parallels with what you describe in medicine as well, how high functioning professionals keep giving and giving until the system itself is overtaxed.
Yeah.
So, I want to point out to our audience here that burnout isn't a weakness, it's a signal that the internal system needs care. And like Jessie, like she did it in her life, there's so many more, right, who really needs to take that approach and be conscious of their choices and take power in their own hands. Because, in medicine, we see burnout, perfectionism, and emotional exhaustion consistently, whether
Yeah.
we're talking about residents, nurses, physicians. I notice similar patterns in corporate teams where executives feel constantly on making endlessly high stake decisions, like I just mentioned, right? So now coming to from an individual perspective to organization, from your perspective, what really drives this culture of overfunctioning and why is it so persistent across fields? Like, is it a systemic thing? No?
Yeah. So yes. I mean, burnout itself is a system problem. So without the
Yes.
systems, we wouldn't have burnout. Like it's inherent to the definition, basically.
Yes.
It's not in the diagnostic manual. It's not something like depression. If you're away from work on vacation, you feel better because you're not in the system. If you're depressed and you're on a beach, you're depressed on a beach, right? Like it doesn't work that way. It's
Yes.
very clearly coming from the way that work is, right? And I think when you think about high functioning workplaces or high producing workplaces, a lot of what you'll see is you get praised for overwork, right? And
Yes.
so you're getting really good feedback until you're not. Even if you are a little late on a deadline or something, you did more and that's great, so keep doing more. And so positive reinforcement for quote unquote challenging behavior or bad behavior is going to make you still do it. Like you're going to do it. And like,
That's
especially
right.
from a boss or someone you respect. And like, we don't get a lot of gratitude in the workplace either. So getting it from any perspective is going to make you keep doing those behaviors. So we overwork because we get like, oh, that's so great. You can ask
Recognition.
Jessie, she'll do it. She'll finish it. That's what she does, right? Like that's just how
Yeah.
we are. We just keep going. A lot of systems don't have a lot of redundancy. So if not you, then who? And the answer is often no one. And if it is somebody on your team, maybe they don't have all the same skills, or maybe you haven't had time to develop them in the way you want or support them in the way you want, or maybe they're only supposed to do this tiny little bit of area, but you need their help with something else, but they aren't really who you should ask. And if that's a problem, I think we don't have a lot of redundancy. We don't have a lot of support staff because sometimes that gets cut for budgetary reasons pretty
Yep.
quickly, like administrative support or like lower ranking, for lack of a better word. Like people on your team might not be people might understand why you need them, but like
Yes.
most of the time in medicine we say things like, I'm not working at the highest part of my license. Like we mostly mean like, I went to med school, I should do medicine. I
Yeah.
shouldn't be talking to an insurance company for 100 years, or like taking someone's blood pressure on intake, like things that other people could be doing that would make
Yes.
this more efficient and like for everybody should be being done. But we tend to, as systems, not always do that because it's expensive, and
Yes.
cost overrides a lot of things in decision making. Cost overrides support and redundancy all the time. I think if you're a person who's effective and you do it anyway, why would they get you support? You did it anyway,
Absolutely.
you know?
Yeah.
So it
It's
like
getting
is it
done.
it's a sort of like self-fulfilling prophecy of this like workplace that we've built. I think also, you mentioned like burnout's not a weakness. I think one of the things that I've noticed in my folks that I see is that it's almost like burnout is an expectation of the
Yeah.
workplace, and
It's a badge of honor.
yeah,
Kind of.
and like
Yeah.
not a good way, like not in like a, I can then prevent it or I can then focus on myself, but in
Yes.
this like I think everyone just feels like this, so it doesn't have a name. That's just work. And if you work, this is how you feel. And so if you look around and everyone looks like that, and then you go like, I don't want to feel like this is bad, then you go, oh, that's me, I'm the problem. Then it becomes a
Yes.
weakness because everyone's miserable, but you decided to stop being miserable. And that's not good. And so for me, like, I was shocked that I burnt out from a job that is clearly going to burn you out. Seeing healthcare workers as a psychiatrist at the height of a pandemic. Tell me something that sounds
Yes.
less emotionally exciting than that.
Taxing. Yeah.
So it's just like, of course you burned out. Instead of like, how dare I burn out? How did I get to this place that I burnt out? And like, what's wrong with me? Right? Like,
Yes.
duh, you burned out. Like, it's like designed to burn you out. Like, I don't know how else it would exist.
That makes sense. And I think kind of what you're saying, I think leaders have to play a more critical role. But again, I come back to leaders are humans too. So I think from my perspective, what I feel is yes, the ownership is on the leaders of creating that culture, creating the system that way. That's burnout is not the badge of honor, not the obvious thing. Like, okay, that's how we work. If you are not doing that, that means you're not putting enough effort or time
Mm.
into your work or you're not dedicated. But I think leaders' own behavior talks a lot because that gives others permission to do what they want to do. So I'll give you an example. Like when I was in my last organization, it was a small knit organization and we were all wearing multiple hats. And I was the head of HR there. And I would put an out of office message that I'm out for vacation. Okay. And then I'm sitting at the beach with my family, with my two kids, and the email comes in. And within 2 minutes, I responded to that email. So the person get my out of office message. Then 1 minute later, they actually get my response.
Yeah.
And it was my problem. And I was actually imposing that on my team because now what expectations am I setting for all these 5 people who are reporting to me saying that, oh, you got to do that too because I'm committed. So you got to show me your commitment that way. So that was an kind of I didn't wanted that, but that was the impact of my action. So I think
Yeah.
it really matters what leaders are modeling, or
Yep.
if they're doing that, to be very clear that, hey, this works for me because this is the way I will not think about that. And that's how my brain processes
Yep.
it. But there's no expectation for you to do the same thing, right? That's
Yeah.
just one example. But then
Yeah,
I
I
also,
think very similarly. You know how when you send an email, it says when you sent it? I was
yes,
like, sometimes when I get in a groove of something, I don't realize what time it is. And I sent an email with revisions to a paper to a mentee and at 3 a.m. And she responded in the morning and said, thank you so much for doing this, Dr. Gold. Why were you up at 3? And I had this again, sort of out of body, like sort of
that
like,
moment, right?
oops, like that's terrible role modeling. Like it's just terrible. Like, so now I'm very, very mindful of delayed send as much as I can, but I
Yep.
also like always with students. So if I'm writing back a student or somebody who might like be learning from me, I'm very, very cautious. If
Yeah.
you're on my team, ahead of time, I say like, I sometimes mess up. and I'm on a different time zone, or I
Yes.
had a meeting all day and then I finally got to my email, and I'm going to try my best to delay send, but if I do not, please do not respond. If I need you, I will text you and I know how to find you. Like, this is not an urgent thing. It's my mistake of forgetting to press the button. And that has been helpful as like a thing up front. I also
Totally.
warn people that for me on vacation, it is not comforting to come back to a full inbox.
Yes.
I will
Yes.
not do something like, you asked me to look at edits. I'm not going to look at your edits. I'm on vacation, right? But I
Yes.
will, like,
It's
if
a
it's
quick
something, yep,
reply, right?
I will
Yeah.
forward it. I will get it going. I won't hold it, because why am I waiting 2 weeks or whatever for somebody to like get on my schedule in a month? Like, then you just talk to somebody to get on my schedule, right? So
Right.
like, I will also say to people, I put out an out of office, but I have learned in my experience that I don't like to come back to a full inbox. So you might see that I respond to some things. It does not mean I will respond to all things. And it does not mean that I'm not taking time for me. I am doing this 30 minutes a day, or 2 30-minute blocks a day max. And that's just how I have to cope, because coming back to 3,000 emails is not acceptable to me.
That's absolutely true. And I will point out one thing for our listeners, because sometimes we pick what we want to hear. So, all my listeners, if you just heard, oh, it's okay if you're on a vacation and you answer to email, I want to pay attention to what Jessi said. She specifically said she'll gonna put a 30-minute block or 2 30-minute block, because that's how our brain works. Okay. If you're gonna answer email on the go, you're going into work mode, you're bringing all that information, data, memory into your brain, and you're not going to be present for your vacation, actually sitting there at the ocean. Might as well pay attention to what's happening in front of you. So it's very important to still use your inner technology and know how it works. So do batch processing, have a small batch of time where you're just doing work and then you switch off. It's very important, I think. And I have heard these mixed signals, Jessi, all the time. That's why I'm just clarifying, because as a younger female, when I entered the organization, my superiors said these kind of things and they were right, but I missed the critical part of, I heard what I wanted to hear, that it's okay. So I think it's very important to still know what works for you, personalize it, but use your inner technology to your advantage, how it's wired, because it's high time we start using it rather than it using us. Now, this is one part of how leader is showing up and how, that really impacts their team, right? Their leadership. But I also feel more on an organizational level, and this is coming from my now lead from within work that I'm doing, and this is what I hear all the time. They're always focused on these short-term KPIs and outputs. So they're not seeing the big picture or the long-term vision of this inner capacity and building this sustainable performance across teams and across these leaders, right? They can only model that if they are not themselves exhausted. So, what can we do? Have you found any insights, like, when you were working at the university level now, working with so many professionals, different personalities, have you found something that has worked where they actually see the value of investing in this inner leadership and well-being mentality and really seeing it as the ROI, right?
Yeah, it's hard. I mean, the data to make that argument somewhat exists, but is like a correlation in a lot of ways. Like,
Yes,
there's a lot of information on how much burnout costs a
yes,
company, or costs, in people sitting and not doing their job maximally effective and then quitting and then rehiring, and then, right, like that all costs money. So there is money numbers, but it is like a little hard for people to always tangibly understand. And so, like, for me, especially in the university, like regularly for students, it's like, can I prove in some way that like them having mental health concerns is impacting retention, recruitment, academic success, like something that they're obsessed with, right? Like the things
yes,
that they think about all the time. Like a company
yes.
thinks about profit, a company thinks about, right? Like, so
Retention.
what are the
Yeah.
things that you can like link it to tangibly to make that argument? Like, do not think you can walk into a C-level like executive suite and say, burnout's important because we should care about people. They don't
Yeah.
care about anybody. Even like, I mean, you said you have an HR background. Like, you can tell me they don't really care about people that way either. Like, they care about people in the way that they have to, but they're not caring about like everything about people. They want to make sure you have the benefits so you don't quit and all these things. But again, it goes back to recruitment, retention, and profit. And so I think it's really important that people, even if you're me and you're an empath and all, you do it because you care about people. You cannot walk into a room and tell a story and hope someone else gets it because you told a story. Even when I talk to healthcare workers, like they don't get it unless you can give them concrete information about themselves affecting other people. So like, why does it matter if I'm well? Well, there's a lot of data that when you're unwell, you hurt patients. There's also a lot of data when you're unwell, your whole team's unwell. And so we make all these justifications like I'm showing up for my team, I'm showing up for patients, and the data just keeps saying like that's no, you're not, like that's not true. Like all the data says that's wrong. And so even on the individual level to a person, I have to make an argument that's a much grander scale. And then if you're in a C-suite, you have to make this argument with data as much as possible. But that data is hard to get. Turnover data even is hard to get, to be like, well, what about that particular area? What's turnover like there? They're like, oh, we don't classify by like that. We classify by job role. And you're like, that's not helpful. I need like why is everybody quitting that team? Right. So I can look at that team and what's going on in that team or whatever. And so I think, you know, you might have to get more data than exists. You might have to be creative with correlation and try to make that point. I think you have to have a champion that's not just you. So, you know, for me, my boss understands what I do and helps. Otherwise, I would go into a room like, have you thought about wellness? Have you thought about wellness? And like, that's just not helpful. They go, tell the psychiatrist to shut up, right? Because like, they don't have to listen to me. And so I think it's important that people realize like, yes, companies have advanced, and yes, we talk about this more. And yes, the pandemic brought to very big forefront that emotional health is relevant. And yes, Gen Z, Gen Alpha is like another whole beast that cares a ton about this stuff. And if we don't figure it out, they're not going to do your job. But we aren't really there yet in some of these big systems that like you could give them like the forecast that says, if we stay this way, we will have no one do this field in the next 10 years. And they would go, what do you mean? We always need doctors. So that doesn't help. You have to, as much as possible, like right now, today, how is that working? And do your best to collect that information. Realize it's going to be an uphill battle because it's not recruitment, retention, and profit.
Yeah. No, and I think it makes perfect sense. And that's why when I'm talking to a lot of these executives, it's interesting conversation sometimes. Some of them actually are getting it. And I've been very fortunate to actually network and meet those people who are being very intentional. I mean, one person actually just comes to mind. There was one of this organization, they were very skeptical, but then they brought the lead from within work, seeing all the science and, you know, what has happened in all the other organizations that we have done this work. And we trained their 300 managers or directors or so across US. And in one of those workshops, I'll tell you what happened was there was this resort manager, and she was constantly reacting. Okay, they have, imagine like it's a resort, there's all these guest complaints, team conflicts, operational emergencies happen all the time, and that dominated her days. So she was literally stuck in this reactive loop, which impacted her interactions and team dynamics. So there were these team issues that were happening. And then during the workshop, she began noticing her internal patterns, like how stress triggered automatic reactions and which emotions were driving her decisions. And just by knowing that and intentionally using her inner science, you know this, she activated her parasympathetic nervous system, and pausing before responding, she got ahead of these patterns. And within 6 months, she had moved from this constant reactivity to proactive leadership. I mean, not every conflict was resolved, but she definitely was able to pinpoint them before they escalated. And she influenced her team's culture positively. And when the administration saw that, they really saw the results firsthand, why this work and actually working at the root cause is so critical, because most of the times we are just, you know, working on the symptoms. We are not looking at the root cause of where this turmoil is happening. I spent years in all my HR work stuck in employee relations where two people are just fighting over something stupid, because, right, they're not really understanding the real patterns and why they're getting upset with this person. So this is why, like, you know, we have been talking about a lot of self-leadership and ownership. So this is why intentional self-leadership isn't just about individual performance. It's the seed you have to plant for shaping team and organizational culture. Because, you definitely can't pour from an empty cup, but you can lead from a full one. So I think it's very critical. So, what are some of the, are there any initiatives, Jessi, that you have started at the university as chief wellness officer that seems to stick and that has, taken some momentum?
Yeah, I mean, so when you start with like you're new in a role, a lot of, and I'll also just emphasize this too, which is like I'm in the system, not the campus. So none of the campus level people report to me. So a lot of what my job is bringing people together for conversation and evidence-based sharing, right? Meaning who's doing what well and how do we do that somewhere else instead of reinventing the wheel over and over and over and over
Yes.
again. I also have this ability to be able to be pulled back from like the day-to-day crises on a campus to be able to like look at prevention, look at these other things, right? And so like some of what I do might seem like not that novel or sexy when you think about it, because I don't have the ability to like, okay, let's do this initiative.
Right.
I have to bring everybody together. They have to decide that it's a good
Makes
idea.
sense.
Then they have to each carry it out on their individual campuses and culture. So that's like challenging. So
Yeah.
I would say big successes for me. We're rolling out the same survey on all 5 campuses in the spring. We've never
Okay.
done the same survey at the same time ever. If you looked at our data right now and you said, Jessi, what's it like to be a student on our campuses? I'd say, well, on this campus in 2020 it looked like this, on this campus in 2024 it looked like this, because they're all over the map when they were done and which like version of the survey, even if they did it. And so this
Right.
will be the only first time that we
That's
actually
cool.
will get all of it to be able to say like, okay, like here's where we are. And I think that's really, really helpful, because doing an intervention without knowing what is needed
That's right.
is a dumb idea. We do it all
Yes.
the time because we like shiny objects and we like
Yep.
buying things, and we hope that buying things, people will shut up and stop talking about the problems. But it doesn't work like that. Like you need to actually understand what's going on, and then you
Yeah.
have to
Do the
make a
gap
creative
analysis.
like intervention
Exactly.
for that. So that's a big
Yes.
thing. And part of that, they also fill out this thing called the institutional profile survey through the National College Health Assessment, which like looks at like how much do they spend on well-being, how many staff do they have in this office, like all
Okay.
this kind of just like I can ask that, but it is concretely done in
That's
this way
cool.
where I will then get 5 back, and I can say when I look at all my campuses, like here's where we are. This campus has a lot more staff but also a lot more money. This
Yes.
campus needs this to even have the baseline we think is acceptable. So that'll be a big thing, I think. Another thing I'm really proud of is we did mini grants. Like we did
Okay.
10 $5,000 grants across the system, and all of them went to pilots that could be well measured, but then could be hopefully ideally used somewhere else, right? So like I didn't fund like I need a wellness suite in my building because I can't do anything with that. Like I can't use that anywhere else. I funded, I'd like to make an online curriculum that's asynchronous that looks at well like looks at key skills for well-being. Cool. I want to fund a new parent coaching program, and I'm going to pilot it here, and then after that we can use the same thing somewhere else. Like everything I piloted or like funded to be piloted can ideally be at least tools wise, content wise, something
That's
applied
great.
somewhere else. So that's the goal. It also broadens the community, right? So like I don't think
Yes.
people always look at like the value of a little bit of investment, but $5,000 is not a lot of money
That's
in
right.
the grand scheme of things. Even less if you wanted, they'd be happy with.
Yep.
And it gets these groups that it's hard to get grants for
Bring
this
them
stuff.
together.
It doesn't exist in the big grants a lot of the time, but it lets me say like, who cares about this on the campus? And like,
That's right.
otherwise, all I know are like directors of counseling, directors of student health. Like, duh, they care about it. It's their job. But like there's this morning, like somebody in biochemistry on one of the campuses who just wants to figure out how to make the biochemistry students less stressed. There's
Yeah.
somebody in nursing who just wants to make a peer support program for her folks. Like they care about it so much, but they're siloed in all these like
That's right.
ways where like I not only have 5 campus silos, I have inter and intra campus silos. So like, I think people discount like the opportunity from that to not just stimulate ideas, do some cool stuff, but also create a wider community to have access to for other things.
I love what you're doing, and it makes perfect sense. I mean, actually, I used to do a bunch of those kind of stuff when I was at Harvard because you just don't know, right? Who is going to resonate with what kind of stuff? What are their values? What are they really looking for? And once you really understand those gaps and needs, then you can really assess, okay, what are some of the, features or tools that I can provide them, which is a very smart way of doing it. That makes perfect sense to me. Now, since you're such a role model of your own life, what I would love to do is for our listeners, what is one thing you stick for your own inner alignment so that even under pressure with so much that's going on in your life, you're not just surviving, but leading with presence and clarity? What do you do for yourself?
This is going to be I'm going to give you two answers.
Okay,
so my one answer is to tell you that like 1 hour a week, I go to therapy. And if I didn't have therapy, it would not be good. Like when my therapist is on vacation, I still use that 1 hour a week and I write like a journal or something during the time because it is so important to me that it's on my schedule, that I have it like there, that it can't go anywhere, that, and it's really helpful. And I think people don't always think about therapy as making you better at your job. Psychiatrists do, therapists do, because we need to understand our own stuff to be better at helping other people. But I almost use it like people like coaches for this reason, that there's this blurred line there, but there is like a way to understand yourself and be more aware about your own issues, to be better as a leader, to be better at work, to show up differently for people. And I think if that's what would make you go towards it, that I would say. So one thing is therapy. The second thing I would say, like just a like skill tool thing that I use really pretty regularly for me, is I honestly like really do try to go like, how am I doing? Like it sounds silly, but for me, that is not just like, how am I doing? Like, am I sleeping? Yes. Am I interacting with people in the way I want? Am I angry? I'm angry a lot. Like that's a primary emotion for me. Like, what does my anger mean? Really trying to give myself time, space, capacity, blah, to sort of go, hey, like, what's up there? And like, not just like blow
be more aware, right? It's helping you be more aware of what's really going on, and you can track it in a more measurable way that helps you.
Yeah. And I think like what my therapist would tell you, like there's this desire to go, okay, I'm angry. Yes. I don't want to be angry anymore. Like, and then I'm going to go do something about it. And so like, I am the queen of that. Most of us are the queens of that, because if you actually are angry and let yourself be angry, you won't get as much done. So you will go, I'm angry. Oh, what helps? Going for a run, going in a hot shower, going in the jacuzzi, like, I don't know, mindfulness, whatever it works for you, right? Like you'll go right to that. So I have to go, I'm angry, and I don't have to fix it. And like, that is really hard for me, but I struggle with it regularly. I will also just tell people I'm a constant work in progress. Like I regularly have to like, keep re-upping my own stuff that I lecture on, right? But I think it's important to say, like, not only am I making time for me and being more aware of me in the equation, I'm also not rushing to fix it. Like we do the same thing with other people. Like if a colleague or a friend is like, I'm just not feeling good, you're like, how do I get you to a therapist, right? You're not like, I'm just going to sit and hear you and not give you advice or tell you my story or try to make it so we're like fixing this. Sometimes you don't need to fix it. Like sometimes you just need to be sad. You don't need to be sad for 3 weeks, but sometimes you need to be sad for 20 minutes. And that's okay, right? And so I think that's a thing for me too, is like really mindfully being like, okay, like you feel off. Why do you feel off? What's going on? How would you explain that to yourself? Do you need to fix that right now, today, to feel better, And the answer is like, probably not. And I think that's also okay, right? And so my suggestion would just be like, not just identifying it, but also giving yourself space to not fix it immediately.
That makes sense. That makes sense. And it's interesting. I think it was my last episode or last to last episode. We were talking about this inner alignment and balance. And I was sharing with everybody that what I learned a few years ago and really helps me is like, you have this and this, like your stress wave or that wave that comes, that stays for like 90 seconds, that emotion. So if you don't retell that story or keep ruminating about it and let it just pass, a lot of those smaller stresses just goes away when we don't react to it and we just sit in it and we accept it. This is how I'm feeling, and let us just pass those 90 seconds, and then you can actually respond rather than react to what you really want to do with it. So yeah. I think, again, what works for you. But thank you, Jessi, for sharing your insights and for the incredible work you're doing to make leadership and caregiving honestly more human, intentional, and impactful. Your example shows why inner alignment matters, not just for individuals, but for shaping organizational culture, stepping into a new role, making long-term impact. And we will have Jessi's information in the show notes and a link to get her book, which I highly, highly recommend everybody to definitely check out her book. These insights, aren't just for surviving. They're about creating leaders and organizations that thrive long-term. Because by cultivating inner capacity, leaders not only improve their own performance, but also create a culture where teams can flourish, giving the next generation of leaders a model worth following, And this is why philosophies like Lead from Within, the work that Jessi is doing, it matters. It gives leaders an operating system for their inner state so they can respond intentionally, make conscious choices, and lead with empathy, clarity, and resilience. Jessi's work brings that same principle to scale in organizations, showing that when systems prioritize well-being and inner alignment, everyone from students to executives benefits. Whether you're in a hospital, a courtroom, a corporate boardroom, a leading frontline team member, the takeaway is simple. Care for your own inner system first, and you will lead more effectively and sustainably. Now, one simple action you can start today is to pause for 60 seconds each morning to check in with your energy, priorities, and mindset before diving into your day. A small step that recalibrates your system and sets the tone for intentional leadership. Take care, everyone. And thank you again, Jessi. It was such an amazing joy and wonderful experience just talking to you.
Thank you for having me.
All right. Take care.
So that's it for today's episode of Her Boss Brain podcast. Head on over to Apple Podcasts, iTunes, or wherever you listen and subscribe to the show. One lucky listener every single week that posts a review on Apple Podcasts or iTunes will win a chance in a grand prize drawing to win a $25,000 private VIP day with Pallavi herself. Be sure to head on over to herbossbrainpodcast.com and pick up a free copy of Pallavi's gift and join us next time.